I have been asked by folks, does that mean we're working less on the coronavirus? No, it does not mean that at all. We still have a 24/7 operation to keep Rhode Islanders safe, but we are in a different phase now where we are not out of the woods, but also not living the daily crisis that we once were. It's still incredibly important that you tune in, that you get your information. Next week, we will have actually a number of very important announcements, but I just decided we're in phase 2 now, and it was okay and appropriate to go to 3 days a week. So I look forward to seeing you on Monday at 1 o'clock and again on Wednesday and Friday. Thank you. Okay, we will begin, as we always do, with a picture of the data. I want to take a second to thank my data team. We've all become accustomed, myself included, to having the most accurate data at our fingertips. This is hard to do. It is hard at the end of every day to collect the data from the hospitals, collect data from nursing homes, collect data from cities and towns, every testing site all around the state. And it's a great credit to the folks who are working hard to make this happen, so I want to say thank you. As you can see from the data on the screen, yesterday was a good day. It's actually a very good day. We tested nearly 4,500 people. That's a record. That's a testing record. Nearly 4,500 people tested in the state of Rhode Island. It's the most we've ever done in a day. That's fantastic. And we saw a test positive rate of just below 3%. So that's excellent. We're testing thousands of people all over the state, and the test positive rate is the lowest it's ever been, less than 3%. We are reporting today another 113 new cases, and very sadly, another 16 fatalities. We will continue to every day track. We will continue to keep you updated. We will be prepared to make changes as necessary if the data changes. But right now, we're in a very stable place, and I feel excellent and confident that we are doing the right thing by reopening our economy and moving ahead as we are with phase 2. The other day, I was asked at a press conference about some of my executive orders that were expiring, and I want to take a minute to tick through a few executive orders to let you know which ones I'm reinstituting or renewing. So a month or so ago, I signed an executive order directing everybody in a public space, any public space, indoor or outdoor, to wear a face cloth covering, a simple face cloth mask. I have extended that executive order for another month until the 4th of July. So I am asking everyone, please, if you are in a public place, inside or outside, to have a face cloth covering. That is until July 4th via executive order. Now, I want to be clear about this. The guidance from the Department of Health is if you are able to maintain continuously 6 feet of distance with everyone around you, you need not wear a face cloth covering. So obviously you do want to use some common sense about all of these rules. If you are alone working in your office, you do not need to wear a face cloth covering. If you leave your office to use a shared bathroom, or you're going to go to a conference table, or a room where you're going to be with some of your colleagues, then please make sure you put on your face mask. If you can be in a room where you can be safely and continuously 6 feet apart, you do not need to keep your face mask on. But this is designed, if you're at a restaurant, if you're driving through a drive-through, if you're crowded with people for more than 10 minutes at a time, you are going to want to have your face mask on. I will say we continue to see excellent compliance. In fact, last weekend, when we did our spot checks of businesses, we saw better compliance than the weekend prior. I think we're just getting used to it. It's an unusual thing to do, but we're getting used to it. And definitely, if you're in a restaurant or you're in a grocery store, you're in retail, getting your hair cut, et cetera, please have your mask. The way I think of it is, it's just like your phone, your wallet, your purse. You don't leave your house without it. Don't leave your house without your mask. There are a number of additional executive orders also that I have extended. I want to go through them quickly. A few months ago, on March 9th, shortly after the first cases of coronavirus, I declared a state of emergency here in the state of Rhode Island. That state of emergency is still in effect. I have just, again, reissued that state of emergency until the 5th of July. So until the 5th of July, we remain in a state of emergency. I extended it for 30 days. Why are we doing that? It makes sure that we have access to all of the necessary federal resources that we need as we fight this crisis. Also, it just gives us the flexibility that we need in my administration to move quickly in order to make sure that we meet the needs of the crisis. The other one that I've extended until the 5th of July relates to telemedicine. Yesterday, I spoke at length about how I believe we have an opportunity now to reorient and rebuild and redesign our entire healthcare system. Part of that means a greater reliance upon telehealth. We've seen a lot of success providing healthcare to people through phone calls and video conferences, and we want that to continue. So I have issued another executive order through to July 5th as it relates to telemedicine, which directs all health insurers in the state of Rhode Island to cover telemedicine for primary care, specialty care, mental health care, and behavioral health care until July 5th. And that includes a simple phone call or a video conference. The executive order also requires reimbursement rates for providers to be the same for healthcare delivered in the office as they are for telemedicine. This has been critical to break down barriers to access. I want to thank the health insurers for their great work on this, and I want to thank providers. This is new for you. You've had to adjust your practices to enable this, and I want to thank you for that. I will say this new executive order ends July 5th. If I have to extend it after July 5th, I will. At the same time, I want to work with the legislature to make this permanent. We've learned there's a role for telemedicine, and it ought to be provided and paid for. And so I would like to work with the legislature to make this a permanent feature via statute so we don't have to do it month to month. A note about quarantine. This is very important, and I signed this executive order as well. As we begin to reopen the economy, go back to work, go back to living the way we want to live, it is going to be more important that we follow the rules. The mask wearing, the hand washing, 6 feet apart, all of it. One of those very important rules that I haven't talked about in a while is quarantining. Quarantining is a fancy way of saying staying at home. Stay at home if you're sick. So I want to reiterate with clarity the executive order, which is in effect until July 5th. If you have been diagnosed with COVID-19, you need to isolate until you no longer have symptoms. If you've been in close contact with somebody who's been diagnosed with the coronavirus, then you need to quarantine for 14 days. So what does that mean? If you live with somebody in your family gets tested positive, it means you have to be in quarantine, stay at home for 14 days. Can't go to work, can't go to the office, can't leave your house for 14 days. If the Department of Health calls you and tells you that you've been in close contact with someone who's tested positive, you must quarantine, stay at home for 14 days. This is a big one, it's important. The executive order related to quarantine and isolation is in effect until July 5th. This is also why I keep talking about contact tracing notebooks and using the Crush COVID RI app. If you have your contact tracing notebook, and you get a call from a friend or a call from the Department of Health who tells you someone in your notebook that you've had close contact to now has the coronavirus, you must stay at home for 14 days. I also want to remind employers that your employees must stay home for 14 days. They cannot be punished for staying home if they're in quarantine. They should be paid sick leave if they're at home in quarantine. They should be able to work from home, but by law, if you're in close contact with someone with the virus, you need to stay home for 14 days. And by the way, if you're at home on quarantine, it's very important that you track your own symptoms. And again, I would just encourage you to use the Crush COVID app. There's a symptom tracker on there. You're gonna want to track your own symptoms very carefully in case you come down with the virus. A couple more quick announcements for today. It's Friday, it's been a long week, so I'll endeavor to keep this quick today. Earlier this week, I mentioned the United Way is leading a Be Kind Rhode Island statewide challenge. I've asked you throughout this crisis to be kind. I can't emphasize it enough. So I'm asking you, every Rhode Islander, myself included, my family included, my staff included, do something kind for somebody this weekend. Do something kind for somebody this weekend, and then share it on social media with the hashtag BeKindRI. Could be simple. Send a text, cheer somebody up, deliver somebody groceries, call your mom, look in on a loved one, call somebody or face chat with somebody who's in a nursing home. Just do something nice. Hold your tongue when you feel frustrated. Be patient, be open. Do a kind act over the weekend, and if you can, post it on social media, hashtag BeKindRI. And thank you to the United Way. One act of kindness is great. A million is even greater, and this effort is meant to amplify the kindness, and I really think now more than ever it's going to get us through. Finally, I do want to take a second to address the Rhode Islanders who plan to participate in the protests this weekend. Today in Providence at 4:30, we're expecting a protest. Tomorrow, there'll be a protest at Colt State Park. I believe there's another one planned for Newport. Earlier this week, there was one in Woonsocket. So let me say this. If you plan to engage in one of these peaceful protests, I think that is your right. And I think at this moment in time in America's history, it's vital that you make your voices heard and stand up against injustices. It is, however, also vital that you be aware that we are still fighting a deadly virus. Coronavirus hasn't gone anywhere in the state of Rhode Island. It's still here. We've just learned how to deal with it and be safe. So I'm asking you, if you're going to go out and participate, wear your mask, bring some hand sanitizer with you, don't participate if you're sick. If you have a loved one who you live with who is sick, who is older, think twice before going, and if you do go, be extra vigilant. We will have folks from the Department of Health, actually lots of volunteers from the state, who will be at tables with T-shirts. They'll be passing out masks if you forgot a mask, passing out some hand sanitizer, providing you with information about the virus. We want you to protest. We want you to exercise your rights. We want you to stand up against injustice and be part of a movement that will bring about change. We also need to keep Rhode Islanders safe. And the virus is still very much with us. So I'm just asking you to be safe and, follow the rules. I also want to say this. Last weekend, there was a beautiful, powerful, meaningful, peaceful protest at the State House. It was peaceful. It, I believe, will lead to change. And there were people from all walks of life that were there, socially distanced, wearing masks. This moment calls for peace and activism. And so that is what we're going to have today. I believe these protests, everything I know is that these protests will be peaceful, and we're going to do everything we can to maintain the peace and allow people to exercise their right to protest.